Let's start our topic with basic concept of cardiomyopathy. Cardiomyopathy is a disease of the heart muscle. In this condition, the heart muscle becomes abnormal, which makes it difficult for the heart to pump blood effectively to the body. Cardiomyopathy is actually a general term used for diseases of the heart muscle. In cardiomyopathy, the walls of the heart chambers may become stretched, thickened, or stiff. Because of these changes, the pumping function of the heart is impaired. So in simple words, cardiomyopathy means heart muscle disease. Today I'll be explaining dilated cardiomyopathy, not just in definitions, but in a way that helps you visualize what is actually happening inside the heart. What is dilated cardiomyopathy? Dilated cardiomyopathy is a condition in which the heart chambers, especially the left ventricle, become enlarged and weak. To understand this simply, think of the heart like a pump. In DCM, the pump becomes stretched and loose, so it cannot squeeze properly. Because of this, the heart pumps out less blood, and the body does not get enough oxygen. So, why is the left ventricle important? The left ventricle is the main pumping chamber of the heart. When it dilates, the muscle fibers are overstretched. They cannot contract strongly. Blood remains inside the ventricle after each beat. This leads to reduced ejection fraction. Now we will discuss how the patient will present. The patient will present with symptoms of heart failure, which we will discuss one by one. First one is dyspnea, simply known as shortness of breath. This happens because blood backs up into the lungs, causing pulmonary congestion. Next one is fatigue, because less blood is pumped to muscles, so patients feel tired even on mild activity. Third one is orthopnea. Patients feel breathless when lying flat because fluid shifts to the lungs. Last one, which we are mentioning, is peripheral edema. Fluid accumulates in the legs due to poor circulation and venous congestion. All these symptoms are due to poor pumping ability of the heart. Other important symptoms include arrhythmias due to the stretched heart muscles that disrupt the normal electrical pathways, thromboembolism, due to which blood stays longer inside dilated chambers so clots can form. And the last important one is chest pain that occurs due to increased myocardial oxygen demand or ischemia. Now, if we talk about inheritance pattern, most familial cases show autosomal dominant inheritance, which means that one affected parent can pass the disease. So family screening is important. Now let us understand why the heart becomes weak. First point in the pathogenesis is genetic causes, which include genetic mutations in proteins responsible for muscle structure, such as titin. These proteins normally help the heart contract efficiently. When they are defective, the heart muscle becomes weak, resulting in impaired force generation and poor systolic contraction. Secondly, viral infections is the cause. Viruses like Coxsackie virus infect the myocardium and directly damages heart muscle cells, leading to inflammation, further weakens contraction. This condition is called viral myocarditis, which can progress to DCM. Toxins can also contribute in development of DCM. For example, alcohol, chemotherapy drugs, and heavy metals. These toxins damage the mitochondria of heart cells, so the heart is unable to produce energy, and without energy, the heart cannot contract effectively. Other important contributing factor is pregnancy and metabolic disorders, like thyroid disease and diabetes. These increase blood volume and metabolic demand. The heart is forced to pump more, leading to volume overload. Over time, the ventricle stretches and dilates. The next one is iron overload. Excess iron causes oxidative stress. Free radicals damage heart muscle cells, and this leads to myocardial dysfunction. And the last contributing factor is catecholamine excess. High levels of catecholamines increase heart rate and contractility that are initially helpful, but chronic excess causes myocardial exhaustion and damage. All causes lead to the same final result, that is, weak systolic contraction, ventricular dilatation, and thin ventricular walls. The heart becomes large but weak. This results in reduced ejection fraction, that is, heart failure with reduced ejection fraction. Now let's talk about complications that what can go wrong. If untreated, these conditions include severe heart failure, sudden cardiac death due to arrhythmias, thromboembolism, stroke, systemic emboli, and mitral and tricuspid regurgitation due to annular dilatation. Now coming to the investigations, how we diagnose it. First investigation is echocardiography. This is the most important test, and its findings include dilated left ventricle, thin ventricular walls, enlarged chambers, and low ejection fraction. In short, echo tells us structure and function of the heart. ECG changes occur due to conduction defects. Common findings: atrial fibrillation, ventricular arrhythmias, prolonged QRS complex. These explain the risk of sudden death. Cardiac MRI. Next investigation is MRI white shows late gadolinium enhancement and mid-wall fibrosis. Fibrosis means permanent damage to heart muscle. It also predicts poor prognosis. The last step to discuss is management, how we treat DCM. First of all, lifestyle measures. Avoid alcohol, prevents further damage. Genetic testing, family screening, medical treatment. Chemotherapy includes beta blockers, which reduce heart rate and oxygen demand, ACE inhibitors, ARBs, which reduce afterload and remodeling, diuretics, which relieve symptoms by reducing fluid overload. These drugs do not cure, but slow disease progression. Device therapy. CRT improves coordination of ventricular contraction. ICD prevents sudden cardiac death. Advanced treatment. Cardiac transplantation for end-stage disease. In summary, dilated cardiomyopathy is a disease where the heart becomes big, weak, and inefficient. Early diagnosis, proper treatment, and family screening can greatly improve survival. That's all for DCM. Thanks for watching.